My mission is to protect the most vulnerable, because I'll tell you, as a heart surgeon, the most expensive care is bad care. You got to pay the person who's doing a bad job. You got to pay someone else who's capable to fix the problem, and you got to pay for the complications. And there's so many things we can do to improve care in America. And folks watch this program are probably witnessing and pretty good testimonials out there about what has been done in the past that's not worked well. But here's the good news. We can empower beneficiaries, give you tools, and that's coming down the pike at you. We can make sure providers have better opportunities and incentivize them to do the right thing, because oftentimes in CMS, we've unfortunately gotten folks to do things wrong because we pay them for doing things incorrectly. But right now, my main focus, without any question, is to wage a war on fraud, waste, and abuse.
Okay.
Because that's what's required. All hands on deck. It's a massive issue. You know, hundreds of billions of dollars potentially out there. Not all of it's going to be collected at once, but we've got a war room right now focused very much on things that are going to really bother you. If you thought USAID was a problem, some of the issues that we are discovering, some of the things that CMS has been funding through Medicare and Medicaid and the exchanges will bring a little shiver to you.
Hey everybody, welcome back to the channel. Welcome back to another video. It's me, Kevin, here again today, and I want to talk about a comment that I received on one of my most recent videos. It's actually a live stream that really struck a chord. And it's from a viewer who said, "Here I am again, Kevin. If I suddenly started drawing an extra $200 a month, I would lose my Medicare Advantage plan, which is worth a lot more than $200 a month." This comment highlights a real fear that many seniors face, as I've seen similar comments from others on different videos before in the past. And the worry that earning a little extra income could jeopardize their Medicare coverage or other benefits is a real fear. And I hear you. And I want to address those concerns head on, because no one should feel trapped or afraid to improve their financial situation.
We can attract money by solving problems, adding value, or envisioning possibilities. So if you can solve problems for people, right? If you're a dentist and somebody wakes up today, Saturday morning, and they have an abscessed, throbbing tooth and they're in excruciating pain, they will joyfully, lovingly, gratefully trade you money for your ability to make their toothache go away. The same thing if you are building a temple and you need to buy bricks, and you show them how they can buy bricks cheaper, or how their bricklayers can lay the bricks more efficiently, and they could build the temple quicker, and it's going to lower the amount of time. It adds value to the situation.
Let's start with the heart of the issue. For many seniors, Medicare Advantage plans are a lifeline. They provide essential coverage for doctor visits, hospital stays, prescription drugs, and more, often at a lower cost than traditional Medicare. The idea of losing that coverage because of an extra $200 a month in income is terrifying. And it's not just about the money, it's about the peace of mind that comes with knowing you're covered.
Today, Pramila, Debbie, and I are introducing Medicare for All single-payer legislation. Our legislation would provide comprehensive care to all Americans, rich, poor, young, or old, with zero out-of-pocket expense. It would provide full freedom of choice regarding health care providers. You go to the doctor, the nurse that you want to. No more insurance premiums, no more deductibles, no more co-payments, no more filling out endless forms. No more fighting with the insurance companies to get what you paid for. And comprehensive means comprehensive. It means covering dental care, vision, hearing aids, prescription drugs, and home health care. And you know what else this legislation does? It says to millions of workers in this country, you don't have to stay at a job you don't want to be at just because you have health care at that job.
The viewer also mentioned concerns about big policy changes like Bernie's plan bankrupting the country. And that speaks to a broader anxiety about the future of healthcare and whether the system will be there when you need it. And these are valid fears. And trust me, you're not alone in feeling this way. And here's the good news, folks. In most cases, earning a little extra income won't automatically cause you to lose your Medicare Advantage plan. And whether you lose your Medicare or not, maybe there is a plan to keep folks seeing their doctors. Jan Kirsch asks, what's Oz up to? It's all about the privatization grift. He has a Medicare Advantage for all plan that would steal from True Medicare and Medicaid and require bigger copays, premiums, and less coverage. Oz has invested more than $8 million in such swindles, and this is in response to his post, or the intellectualist posts. Dr. Oz, the uninsured don't have the right to health, but should be given a way of crawling back out of the abyss with 15-minute physicals provided by the government in a festival-like setting. Below that, directly below that, Congressman Greg Murphy, MD, Medicare Advantage plans got a 5% raise today, and that was a few weeks ago, April 7th. Yet the doctors, who are the ones who actually care for the patients, get cut every year. This is ridiculous. And I do want you guys to see this from CMS.gov, latest newsroom report, fact sheet 2026, Medicare Advantage and Part D rate announcement. And I'll quickly summarize this for you guys to give you the long and short for the TLDR. All right, listen up, seniors. The Centers for Medicare and Medicaid Services, CMS, just shared exciting news about Medicare Advantage and Part D for 2026. And these changes could save you money and improve your care. So let's break it down with answers to questions that you might have. Number one, what's new with Medicare Advantage payments? It says here that Medicare Advantage plans will get a 5% or 5.06% payment boost next year, 2026. That's over $25 billion more than this year, 2025. This increase helps plans cover rising healthcare costs. It could mean better benefits like lower copays or extra services for you. Next up on the list, how will my prescription drug costs change? Great news for Part D. Your out-of-pocket drug costs will be capped at $2,100 in 2026. And thanks to the Inflation Reduction Act, insulin will cost no more than $35 or 25% of the negotiated price. Vaccines recommended by the CDC will be free. And not to split hairs here, but Libs of TikTok shared this, and it says, Kamala Harris claims that her admin capped the cost of insulin at $35 and that Trump will eliminate that policy. And it was actually Trump who implemented that policy, and Biden-Harris regime ended up freezing it.
We capped the cost of prescription medication at $2,000 a year for seniors and capped the cost of insulin at $35 for our seniors. That's our grandparents. Yeah. Our parents. Black folks are 60% more likely to be diagnosed with diabetes. His plan would eliminate that cap. We capped the cost of prescription medication.
It's interesting that she says black folks are 60% more likely to be diagnosed with diabetes, which may actually be true, and perhaps maybe one of the driving factors behind RFK Jr. trying to do his damnedest to introduce actual nutrition into the SNAP benefit program.
And again, Secretary Rollins had the soda industry come and knock on her door very much, very loudly, and they said to her, well, the SNAP program is not supposed to be about nutrition. She pointed out to them that there is no nutrition in a soda. And they said, well, it's not supposed to be about nutrition. And she said to them, the name of the program is supplemental nutrition. It is about nutrition.
Supplemental Nutrition Assistance Program. Yes. Pepsi, Coca-Cola, other soda company brands out there providing products that literally have zero nutritional value and in essence are just loaded with sugar that lead to, yes, you guessed it, diabetes diagnosis. And I'd wonder what percentage of black families, black people diagnosed with diabetes are also likely to be a high percentage on these welfare food programs. You see how this kind of goes hand in hand, goes together? But I'm not here to make this extremely political. I just want to provide you guys with the facts. President Trump announces lower out-of-pocket insulin costs for Medicare's seniors, and this was a press release from CMS.gov, May 26, 2020. Today, under President Trump's leadership, the Centers for Medicare and Medicaid Services, CMS, announced that over 1,750 standalone Medicare Part D prescription drug plans and Medicare Advantage plans with prescription drug coverage have applied to offer lower insulin costs through the Part D senior savings model for the 2021 plan year. Across the nation, participating enhanced Part D prescription drug plans will provide Medicare beneficiaries access to a broad set of insulins at a maximum $35 copay for a month's supply from the beginning of the year through the Part D coverage gap. And the model follows on the Trump administration's previously announced 13.5% decline in the average monthly basic Part D premium since 2017 to the lowest level in 7 years. And as we see here, the following year, January 21, 2021, Biden's HHS freezes Trump insulin epinephrine rule until March. Why would he do that? Why would he do such a thing? It says the rule was published in late December, moved part of large-scale regulatory freeze by new administration, and the HHS Thursday froze the former Trump administration's December drug policy that requires community health centers to pass on all their insulin and epinephrine discount savings to patients.
Making sure that we continue to strengthen our healthcare system, making sure that we're able to make every single solitary person eligible for what I've been able to do with the with the COVID. With dealing with everything we have to do with. Look, if we finally beat Medicare.
Thank you, President Biden. President Trump.
Well, he's right. He did beat Medicare. He beat it to death, and he's destroying Medicare.
A new subsidy program may also lower costs for certain drugs. Next up on the list, will my plan stay high quality? An extreme concern for many, and CMS is updating the star rating system to ensure your plan delivers top-notch care. They're adding protections for natural disasters and fighting fraud, and these changes keep your plan affordable and reliable. What else should I know, or should you know? CMS is using the latest data to adjust Part D risks, which could lead to more tailored benefits. They expect a 2.1% increase in risk scores, and this helps you plan match your healthcare needs. Speaking of plan matching and healthcare needs, imagine someone you love, your parent, grandparent, or even a friend, missing out on critical Medicare benefits that could save them thousands or protect their health, just because they didn't know the latest updates. In the next few minutes, I'm breaking down the must-know Medicare changes happening right now for 2025 that could make a huge difference for them. And stick around, because you're going to want to share this with someone you care about. And if you're on Medicare or nearing the age in which you will be applying soon, then you're going to want to pay very, very close attention. And at any point in time, you need to pause this video or rewind or pick up the phone and just dial and call. And I encourage you, call Chapter, our partner, for free Medicare help at any time. 270-467-2426, or visit their website, askchapter.org/Kevin, my name, Kevin, or just give them a call. It's 100% free for free Medicare help. And I think with the recent news and what I'm about to share with you, you're going to want to talk to someone who has a full understanding of how to navigate this complex and oftentimes extremely confusing, potentially money wasting Medicare and all 24,000+ options. Now, quick show of hands, how many of you want to save money instead of wasting money? So it doesn't cost you anything to call. It's 100% free. Call our partner, Chapter, 270-467-2426, and tell them Kevin sent you. What's next for you? Depends. Let me know in the comments in the chat window what you guys think about all this. These updates aim to make your Medicare Advantage and Part D plans more affordable and valuable. Check your plan details during open enrollment to see how these changes affect you. It says here, visit cms.gov for more information. And also make sure you give our friends over at Chapter a call for a free Medicare consultation and free Medicare help. 270-467-2426 or askchapter.org/Kevin. Everybody so far seems to be dialing and making the easy phone call, 270-467-2426, and getting the information and help that they need. In addition, we want to hear from you. So make sure you pick up the phone and call, or at the very least, leave a comment, drop a comment, whether you've called or you have not. And those who have, I really do appreciate you coming back and sharing your stories, because I think it's really eye-opening and it shines light on the subject and helps others as well tremendously. A huge impact, which I'm going to share with you those comments here in just a moment. More importantly, I want to know what excites you most about these 2026 changes. Is it the $2,100 drug cost cap, or is it the free vaccines? Do you have questions about your plan? And if you would, please share your thoughts in the comments or in the chat window. Your input builds a community, our community. And be sure to like, subscribe, and stay tuned for more updates.
That if it's fraud or something, we're going to find it's going to be strengthened, but won't be touched. Medicare, Medicaid, none of that stuff is going to be touched.
Nothing.
You don't have to. Now, if there are illegal migrants in the system, we're going to get them out of the system and all of that fraud, but it's not going to be touched.
And he's not the only one who feels that way. Noah Kaufman, MD. I'm sick of being a doctor whose skills improve year after year, and we get paid less and less every year. So demoralizing. Want to retire. My skills are at their peak. So sad. The system is so broken. I advise young, smart people to go into finance. Only way to survive. Doge AI. Medicare Advantage gets 5% raise while doctors face cuts. Bureaucrats funnel money to middlemen and red tape instead of patient care. HR 2433 tried fixing this mess, but DC keeps prioritizing admin bloat over frontline medicine. Time to slash bureaucracy, put healthcare money where it belongs. Himura says, why I will retire from medicine in my prime. Sick and tired of this nonsense. Arthritis Center St. Louis, of course, Medicare Disadvantage plans got a raise while the physicians doing the work got another pay cut. Fix it, legislators. It is your job to support we, the people, not the insurance cartels. And Pedro Cascullera, MD. I don't know. Sorry, guys. I tried. We all need to opt out, he says. Omar Fernandez says, great post, another excellent one, yet sadly, this is all it is. Just another post in the long line of posts with zero action by Congress. It's beyond pathetic. Investing Doc says, it's so clear that they are paid off by these big health companies. It's total BS. Dr. Rob Davidson, MD, MPH, he says, can we just call them what they are? Privatized Medicare. That's why they're so expensive and cover so little. Bring Medicare back to what it was intended to be, not a grift for private insurance to take our tax dollars and not provide care. Roberta Anding, wonder what would happen if the MDs in this country had a hands-off day. And Jamie K. MD, $25 billion for insurance company marketing schemes to trick patients into signing up for these garbage plans. 3% cut for docs. Seems fair.
Of the health care of the American people. It is outrageous that Donald Trump and congressional Republicans are trying to enact the largest cut to Medicaid in American history. They will hurt families, hurt children, hurt seniors, hurt women, hurt veterans, and hurt disabled Americans. Hospitals will close, nursing homes will shut down, and people will die. This budget that Republicans are trying to jam down the throats of the American people at the direction of Donald Trump is unconscionable, unacceptable, and un-American. And Senate Democrats and House Democrats are going to do everything possible to stop this.
Your Social Security is not under attack. Medicare is not under attack. Veterans' benefits are not under attack. But our very existence is under attack. And this has happened by dirty, greedy, lazy politicians and bureaucrats who have plunged you and chained you in $36 trillion in debt. You are under attack, and you've been under attack by your own federal government. We're here today proudly to talk about how we can reduce this debt, and this is a bipartisan issue. Selling federal property and returning the money back to the American people is the right way to protect you. And as Republicans, we believe in this, and we proudly stand with President Trump, Elon Musk, and their DOGE efforts to reduce the size of the federal government, reduce the federal debt, and we are so grateful, and definitely America voted for President Trump to stand up for Americans, the American worker, and American companies with tariffs that return the order back to America and defeat the globalists who have attacked American interests, stolen intellectual property from American companies, and have turned rural America into a graveyard of factories that have been shut down and American jobs that have been shipped overseas. So I want to say directly, thank you, President Trump, for standing up for us. And we will be so happy when you stick up for us and make it fair again through these tariffs.
My mission is to protect the most vulnerable, because I'll tell you, as a heart surgeon, the most expensive care is bad care. You got to pay the person who's doing a bad job. You got to pay someone else who's capable to fix the problem, and you got to pay for the complications. And there's so many things we can do to improve care in America. And folks watch this program are probably witnessing and pretty good testimonials out there about what has been done in the past that's not worked well. But here's the good news: we can empower beneficiaries, give you tools. And that's coming down the pike at you. We can make sure providers have better opportunities and incentivize them to do the right thing, because oftentimes in CMS, we've unfortunately gotten folks to do things wrong because we pay them for doing things incorrectly. But right now, my main focus, without any question, is to wage a war on fraud, waste, and abuse.
Okay.
Because that's what's required. All hands on deck. It's a massive issue. Hundreds of billions of dollars potentially out there. Not all of it's going to be collected at once, but we've got a war room right now focused very much on things that are going to really bother you. If you thought USAID was a problem, some of the issues that we're discovering, some of the things that CMS has been funding through Medicare and Medicaid and the exchanges will bring a little shiver to you.
And that's why I am thrilled, so excited to have the opportunity to share with you our partner chapter for free Medicare help. The numbers on the screen, many folks like you have already called and have received tremendous amounts of support, answers to questions, and help them save money. Now, granted, not everybody is going to save money, and the amount of saving could vary, but the call is free. The numbers on the screen, 270-467-2426. Call our partner chapter, tell them Kevin sent you, or visit their website at askchapter.org/Kevin, Kevin. Now, this fear of losing your coverage can hold you back, and you might avoid a side job, a small investment, or even a pension adjustment because you're worried about the consequences. And I get it. So let's unpack this fear for many seniors. A Medicare Advantage plan is more than just insurance. It's security. It covers everything from hospital visits to prescriptions, often with lower out-of-pocket costs. The thought of losing that because of an extra $200 a month feels like a huge risk. And why? Because that plan might save you thousands of dollars a year, and giving it up could mean financial strain or even skipping needed care. On top of that, the viewer's concern about Bernie's plan reflects a deeper anxiety about the future of healthcare in America. Will Medicare still be there? Can the system handle big changes? These are real heavy worries, and I want you to know you're not alone. Here's the reassuring part. In most cases, earning an extra $200 a month won't cause you to lose your Medicare Advantage plan, and Medicare eligibility is based on age or disability, not your income. That said, some related benefits like Medicaid, extra help for prescriptions, or Medicare savings programs can have income limits. A small income increase might affect those, but it's not a simple one-size-fits-all rule. For instance, Medicare savings programs have specific thresholds that vary by state, and an extra $200 might not push you over the edge. The trick is knowing exactly how your benefits work, and that's where things can feel a bit overwhelming. No one wants to trade a little extra cash for a big loss in benefits, but here's the thing. You don't have to guess or go at it alone. Understanding your options can help you boost your income while keeping your coverage intact. And that's why I'm extremely excited to partner with Chapter, a team dedicated to helping seniors navigate Medicare for free. Now, let me tell you about someone like you. They also expressed worry about big policy proposals, saying, I don't think this country or the country can afford Bernie's plan. I think we'd be bankrupt within a couple years, and this comment captures a real fear that many seniors have. The possibility that earning a bit more money could cost them their Medicare coverage or other critical benefits. And today, I want to address these concerns and offer some clarity, while also pointing you toward a fantastic resource, our partner, Chapter, for free Medicare guidance. Now, I want to tell you guys a story of someone like yourself. And let's just call her Susan. And Susan's on a Medicare Advantage plan that she loves, and it covers her heart medication and regular checkups, saving her hundreds each month. She's been offered a part-time job that would pay $200 extra a month, but she's terrified it'll cost her her plan. Susan feels stuck, thinking she has to choose between paying her bills and keeping her health care. And then she reaches out to Chapter for a free consultation. Their experts review her income, her plan, and her benefits. They explain that her Medicare Advantage plan is safe, but her extra help program has an income cap. They find her a similar plan that keeps her costs low and show her how to stay under the threshold. And now Susan's earning extra money and still has the coverage she needs. That's the power of getting personalized advice. Now, granted, this was a hypothetical scenario, but it paints the picture of if you have questions, why not ask them to those experts who can give you the answers, who have seen so many different cases and have the ability to navigate and dissect the confusing and complicated language of over 24,000 plans and options and find one that works best for you. That's the key here. Finding personalized care and getting personalized advice for free. And if you're feeling like Susan or the viewer who left that comment that I read you at the beginning of the video, I urge you to contact Chapter for a free Medicare consultation. Their team will look at your specific situation, your income, your benefits, your plans, and give you clear, honest answers. They can tell you exactly how an extra $200 a month would affect your coverage, if at all. And they'll also explore every option to maximize your benefits, whether it's switching plans or finding new savings programs, and it's all free. With no pressure to make changes, Chapter's goal is to give you confidence and peace of mind, and that's what we all want, right? In addition to increased income. And if you guys want to talk about increasing your income, passive income, side hustles, side businesses, getting started making money online, or doing what I do for a job, which is one of my 8 income streams right now, making YouTube videos, then by all means, feel free to reach out, contact me, and let's talk. Now, let's touch on the bigger worry about healthcare policy. It's natural to feel uneasy about proposals that could change Medicare or the economy. But instead of letting those fears stop you, focus on what you can control right now. Getting expert advice from Chapter ensures you're making the best choices for your situation. No matter what happens in Washington, knowledge is your best defense. Dr. Money Matters, he says, no matter who's in charge, the profiteering on the backs of patients and physicians continues. This is replying to a previous post of his from a couple years ago. This is why we take care of patients. They, insurance execs, meet the president and make sure their unending profit stream is not disrupted, no matter which party is in office. Now, they strategically chose these photographs. However, regardless of that, the only thing, in my opinion, that really matters is the here, the now, and how it affects you, me, personally, politics aside. This comment here speaks volumes. Let me know your thoughts. Jennifer Lunsford, she says 4 hours ago, starving on Medicare disability, and they don't want you to earn anything. We are starving. Is Jennifer alone in this thought, in this feeling of starvation? Now get this. Kenneth, he says, hey, Kevin, I called Chapter and spoke with an agent named Tracy, and she was the very kind, polite, and helpful and patient and eager to understand what you are actually looking for in Medicare providers. So I'd suggest anyone with questions concerning Medicare to give them a call. Never know unless you ask. With what's going on, things are changing, especially with DOGE on the job. Let's pray for SSA, Trump, and all Magadonians. Peace, Kevin and Squirrel Tribe. That's a new one. Magad. I haven't heard that one before. This one was on the Stephen A. Smith video with Chuck Schumer in the thumbnail. Yolanda Kaufman. Kevin, I thank God for you and your love for the people. Thank you for sharing Chapter with us /me. It really helped me save money and get better coverage. Keep doing what you do. Many blessings to you and family. And this one here, Mickey Frazier, I gave the Chapter number to my mom and they helped her a lot. Look, folks, you can't make this stuff up. This is real. This is actually happening. This is, in essence, what we've all been waiting for, so to speak. And Jane Baum, hey, I thought you were nice for getting help for Medicare people. Thanks for sharing it. Some people aren't very kind. I trust you. I appreciate that. Thank you so much. I'm not going to stop. I am not going to quit. I am never going to give up the fight. And I want to thank you all for coming back here and providing your feedback to help not only me continue to tell this story, but others to get the free help and free Medicare consultation and hopefully answers to questions, and better yet, and the possibility of money savings. And I want to thank you all for tuning in, and a huge thank you to the viewer who shared their comment and inspired this video. If you've got similar worries or questions, leave them in the comments or in the chat window, and I'll do my best to help. Don't wait, folks. Reach out to Chapter today for your free Medicare consultation. It's the easiest step you can take to protect your benefits and your future. And as always, hit that like button. Subscribe if you haven't already. Hit the notification bell. And I look forward to seeing you guys in the next video. Take care for now.